If you or a loved one has cancer but feel lost, and you don't understand the diagnosis, the treatment options, the side effects of treatment, or have other questions on your mind, then online oncology is the best place to find the right answers. Through a series of videos, we will help you every step of the way. Now let's get started with today's topic.
Hello everyone, this is Dr. Riaz with another episode of Be Smart, Fight Strong series about different cancer topics. And today the topic we have is the malignant melanoma, which is a skin cancer. There are about 76,000 new cases of melanoma in United States, and each year about 10,000 people die from this cancer. Now, melanoma is a cancer of the skin. It is not the most common cancer, however, it is the most deadly skin cancer. It is not the most common cancer, but the most deadly one. Majority of the cases of melanoma comes from the skin. However, there are cases that can come from the eye, from the mucosal membranes like mouth or nose or anal canal. And melanoma is a weird cancer because it has a tendency to spread to weird places like brain, heart, and other places where typically other cancers don't go. Melanomas are skin cancers, and usually these cases are detected by dermatologists. Not all melanomas have a dark appearance, and sometimes they can have a normal skin appearance or in fact slightly lighter color than the skin. However, if you have a new dark pigmented lesion on your body which you never saw before, it's new, and if it's changing its size, this is a red flag and you need to see a dermatologist right away to have that lesion properly evaluated. Now, what are the risk factors for melanoma? The most common risk factor for developing melanoma is the sun exposure. The more sun exposure you have, the higher the chance of developing melanoma. People who live at the sea level or people who are in an occupation where they have more sun exposure, like farmers, have a more incidence of developing melanoma than people who are mostly indoors. The lighter the color of your skin, the more chances of getting melanoma. In fact, the incidence of melanoma is the highest in the white Caucasian population, who also have a lighter color of the hair. What are the signs and symptoms of melanoma? Remember the A, B, C, D, E of melanoma. A means asymmetry. So the lesions of the melanoma are not symmetric. They are deformed. They are asymmetric. B stands for borders. What are the borders of the lesion? The borders of the lesion will be irregular for the melanoma. C stands for color of the lesion. So within one lesion, there will be color variation. So some areas will be darker than other areas. D stands for diameter of the lesion. If the lesion is more than 5 millimeters in size, that's a red flag. And E stands for evolving, meaning the lesion is changing over time. So within a few weeks to a few months, the lesion has grown, changed in size, gotten bigger, or spreading wider on the skin. So remember the A, B, C, D, E of melanoma. Now, how do you diagnose? As I said, for any suspicious lesion, you need to immediately see the dermatologist, because dermatologists are the doctors who can properly evaluate that lesion and do the biopsy, which is the ultimate test to diagnose any cancer. So is for melanoma. So dermatologists are usually able to do a detailed skin exam from head to toe and biopsy all the suspicious lesions, and they can do these biopsies in their office. Once a biopsy is done, then that pathology report needs to be read very carefully. And they need to make sure that it was not an invasive melanoma, because if it was an invasive malignant melanoma, then you will need further diagnostic information to see that the melanoma has not gone to the lymph nodes. We call this sentinel lymph node. What that means is that based on the location of the lesion, you check the lymph node which is draining that area. For example, if the lesion is on your arm, then you will be checking the lymph node in the armpit, because that will be the first site where the cancer cells will grow if this lesion has become an invasive cancer. And this is a standard procedure to do. Unfortunately, the dermatologist may not be able to do all that, and he may refer your case to a surgeon who will then do a more detailed excision of the main lesion that you have, and also perform the sentinel lymph node biopsy. The sentinel lymph node biopsy information is very important because that's how the melanoma is staged, and that will also determine the treatment modalities you will get for the melanoma. So if, for example, the melanoma is found within the lymph nodes, then the surgeon will also take out the lymph nodes, because that is a proven strategy to increase your odds of surviving this cancer, going into remission, and hopefully ultimately getting a cure out of this cancer. Also, when we find the cancer in the lymph nodes, then you need whole body scans like CT scan or PET scan to properly stage and make sure that the cancer hasn't spread any further from those lymph nodes, because if it has spread further, that will make it a stage 4 cancer. And usually for stage 4 cancers, we do not perform surgeries unless that surgery is really going to benefit that patient and can increase the odds of they achieving remission, which, by the way, happens in a very select patients, and you need to discuss this with your doctor if your case is one of them. If the cancer is stage 2 or 3, after you get the surgery, you will also get immunotherapy after the surgery. And this strategy has proven to increase the odds of achieving remission and increasing the overall survival from the cancer. Melanomas are very immune dependent, meaning that if your immune system goes down, that gives this cancer a chance to spread and become aggressive. However, if the immune system is intact, then your immune system can also keep the cancer in check. That's the reason we use immunotherapy, to make the immune system stronger, which in turn fight the cancer. However, if unfortunately the cancer has become stage 4, then you need to know certain characteristics of the cancer. And you can also watch my other video where I'm talking about what are the basic facts that you need to know about your cancer, and in that video I talk in more detail. So in stage 4 setting, the detail matters, the detail on the pathology report, and what that report will tell you if your case has certain mutations or not. And based on these mutations, the doctor will decide as to what treatment option is best for you. For a stage 4 melanoma cases, we like to see these mutations. Some of the mutations are BRAF mutation, c-KIT mutation, NRAS mutation. Now, when you have these mutations, you qualify for more treatments compared to if you do not have these mutations. You will be eligible for a targeted therapy if one of these mutations is present. And these targeted therapies seem to work very well for these patients. They come in pill form. None of the targeted therapies are in the IV form, so that gives you the convenience of taking the treatment for your cancer in a pill form. I'm not saying they do not have side effects, because just because they are pills does not make them less effective, and they have a whole set of side effects. For that, I would like you to watch my videos on the side effects of the targeted therapy to know all the common side effects of the targeted therapy. However, if you have certain mutations on your melanoma, that is a good thing in the stage 4 setting because you have more tools in your arsenal to fight this cancer. For cases with positive mutations, we like to treat them first with the targeted therapies and reserve the chemotherapy for a later time and use them only when the targeted therapies have stopped working. These targeted therapies can be used as one medicine or they can be combined to use more than one medicine at the same time. Using more than one medicine gives you a more response. However, it also increases the odds of getting side effects. The other major pillar of treatment in the stage 4 setting is the immunotherapy. All the patients who do not have a mutation will be getting immunotherapy. The immunotherapy is of several different kinds and there are several different medicines which are FDA approved. However, the best combination is when you can combine 2 immunotherapy medicines. Common combination is nivolumab and ipilimumab, which is also a combination for treatment of several other cancers, but in the melanoma that seems to work very well and increase the odds of your cancer responding to the treatment. However, there are other medicines too, like pembrolizumab or interleukins. In this day and age, we don't use interleukins very often. It is not a widely practiced, and maybe some bigger centers may still use it, but in the community setting, usually we use the immunotherapy, which are checkpoint inhibitors, like nivolumab, ipilimumab, and pembrolizumab. And then there are some chemotherapy options. Unfortunately, the chemotherapy option is not very promising in the treatment of melanoma. Historically, the response rate to chemo are very poor, in the range of 10 to 15% and with a lot of side effects. But when you have no other good option, then trying chemotherapy is not a bad idea as well, especially if you are physically in good shape to try chemotherapy. That's all I have on the topic of melanoma. If you have any specific questions, you can leave comment below. You can also email me to ask me any questions. You will get the information on the screen.
We hope you find this video helpful. The more knowledge you have and the more informed you are about your condition, the better decisions you can make about your health. Please spread the message to other people that may also benefit from this knowledge. We have covered several topics about cancer care in other videos. To learn more about these, visit our website, www.onlineoncology.com. You can also visit our Facebook page, YouTube channel, Instagram, and follow us on Twitter on onlineoncology.com. Be smart, fight strong.